My name is Dr. Karan Joshi. I'm an MD in internal medicine, consulting physician based in Siliguri. Today, I'll be talking briefly about the regular blood tests which need to be done to maintain a healthy heart. As we are all aware, the number of illnesses reported today in people is increasing at an alarming rate. Some of these illnesses could be serious if they are not identified at an early stage. So blood screening can provide a snapshot of your current health as well as catch the potential health problems before they fully rise to the surface, and so they can be managed effectively. But this is not only enough. After diagnosed with certain conditions, it is also important to do regular blood tests. So let's see why it is important to do regular blood tests. Basically, regular blood testing is one of the most important ways to maintain overall physical well-being. In fact, I would say that being tested at routine intervals will help people understand how your body changes over time and allows you to make timely decisions for the betterment of your health. So blood tests, they have a variety of uses. If one is experiencing unusual persistent symptoms, for example, fatigue or abnormal weight gain or new pain, blood tests can help to identify the cause of that condition. And also if one wants to optimize their health, knowing levels of various blood components, for example, cholesterol, can help you tweak your diet or fitness plan to minimize unhealthy habits. So before moving on to the conditions that require regular blood test, let me give you an information that you need to know prior to doing a blood test. So generally, most of the tests don't require any specific preparations, and they take only a couple of minutes for the blood to be withdrawn. But sometimes the healthcare professional may tell you that some specific instructions that need to be followed before your test, such as avoiding eating or drinking anything apart from water for up to 12 hours. So it is essential what your healthcare provider says, to follow the instructions given before the test. So before going to the test, which need to be conducted regularly, I would like to briefly mention about how do you check your blood pressure. Now, this is just out of the context. So blood pressure, it's one of the easiest and the simplest diagnostic tools which can tell so much about the current and possible future health. So it is the only way to know if one is high or low BP, which at the end helps in controlling the BP. So blood pressure is the force of the blood against the walls of your arteries as your heart pumps it around your body. So it is expressed in two numbers. The upper number is systolic blood pressure, and the upper number basically is the pressure in your blood vessels when the heart contracts, and the lower number is the diastolic blood pressure, which means the pressure in your blood vessels when the heart rests in between the two beats. So normal blood pressure for an adult, when the adult is resting, is less than 120 over less than 80. So the 120 is the systolic blood pressure, and the diastolic blood pressure is 80. So if your BP level is more than 140 by 90 millimeter of Hg, then you are diagnosed to have high blood pressure, that is hypertension. And in fact, it is possible to monitor blood pressure outside the clinical. It's not that the blood pressure needs to be monitored only in the clinical setting. It is also measured at home using a blood pressure monitor. So to measure the blood pressure at home, you can either use an Android monitor or digital monitor. Generally, the finger and the wrist devices, they usually do not give accurate measurements. So doctor will advise you how long one should monitor blood pressure. Normally we often ask the patients to check blood pressure for 7 consecutive days. Also, apart from that, for diagnosing hypertension, we have ambulatory blood pressure measurements also. So on each day, the patient should monitor blood pressures on 2 occasions: in the morning between 6 to 12 noon, and again in the evening between 6 p.m. and midnight. So each time one needs to take minimum of 2 readings, leaving at least 1 minute in between each. If the first 2 readings are very different, then the patient should take further 2 or 3 readings more. So it is important to know that your blood pressure may go up or down depending on your age, your heart conditions, emotions, activity, and medications that you take. So moving on, let us know about the regular checkup for the blood sugar level. So why it is important that the blood sugar level should be checked? Because of diabetes. Because diabetes is a condition that affects the body's ability to produce or use insulin, which helps the body to utilize blood sugar for energy. Diabetes results in blood pressure that can rise to abnormally high levels. Type 2 diabetes can affect every part of the body, from your eyes to the feet. So critical part of managing diabetes is getting routine tests and checkups, so that the spot problems can be diagnosed early and the complications can be prevented. So number of tests can be used to diagnose and monitor diabetes by checking the level of sugar in the blood. These include Hba1c test. This key blood test measures the average blood sugar levels over the previous 2 or 3 months and helps doctor know how well your blood sugar is being controlled. You have these checks every 3 months when the newly diagnosed, and every 6 months once the Hba1c settles to a stable level. Fasting blood sugar test involves having drawn your blood after you have fasted overnight, which usually means not eating for around 8 to 12 hours. And oral glucose tolerance trends, this test takes place over a course of 2 hours. Your blood sugar is tested initially, and then you are given a sugary drink, and after 2 hours, your blood sugar levels are tested again. And check if you have lost any feeling in your feet, and for ulcerations and infections. You should check for damage of blood vessels in eyes, and also for high blood pressure, heart and kidney disease. In fact, self-testing your blood sugar can play a very important role in the management of diabetes. Blood sugar test kits are also available for use at home. The device measures the amount of sugar in a small sample of blood, usually from a fingertip, that you place on a disposable test strip. The doctor will let you know how often to check your blood sugar levels. The frequency of testing usually depends on the type of the diabetes and treatment plan. For people with diabetes, blood sugar reading should be like fasting should be between 80 to 130 milligrams per deciliter. After 2 hours of fasting, after starting meals, it should be below 180, and Hba1c should be preferred to be kept 7.0 or lower. So another important test is blood cholesterol level. So monitoring of blood cholesterol level. So cholesterol test also, it's called a lipid profile. It basically measures the fats in your blood. The lipid profile measures the risk of having a heart attack or other heart disease. You won't know you have a high cholesterol level until you get tested. Blood cholesterol levels can be measured with a simple blood test. You may be asked not to eat anything for 12 hours before the test to ensure that all the food is completely digested and won't affect the result, although this isn't always a necessity. The test, which typically includes measurements of total cholesterol, it is the amount of blood cholesterol content. A high level can increase your risk of heart disease. Ideally, the total cholesterol should be below 200 milligrams per deciliter. The other is low density lipoprotein, LDL cholesterol. It's also called bad cholesterol. Too much of LDL cholesterol in the blood causes the buildup of fat in the arteries, which reduces blood flow and can lead to major heart complications. The LDL cholesterol should be less than 130, and of course the desirable levels are under 100, especially if there's a history of diabetes or heart attack or bypass surgery. Although recent guidelines suggest that it should be kept as low as possible, preferably below 70 milligram per dl. And the other is high density lipoprotein cholesterol, which is also called good cholesterol, because it helps carry away the LDL, that is bad cholesterol, keeping arteries open. So for male patients, the HDL cholesterol should be over 45 milligram per dl, whereas in women it should be we should aim for cholesterol HDL level of around 55 milligram per dl. The triglycerides are another type of fat in the blood. The high triglyceride levels usually mean that you regularly eat more calories than you burn. So high levels can increase your risk of heart attack. The high triglyceride level should be less than the triglyceride be less than 150 milligram per dl. So the bottom line is that your blood offers many clues about your health. This is just a brief thing about your cholesterol and sugar that I've talked and discussed about. There are a lot of other tests that can be done for maintaining a healthy heart, which will be further told. I would like to suggest at the end that you should get a routine blood test done at least once a year. Thank you.